Hello again, everybody. This is Craig Evans of Autism Hangout, and thank you for tuning into this Autism Hangout special report. With me today is Dr. Nelson Manier. Now, Dr. Manier is a Dan doctor, and he's a chiropractic specialist in orthopedics and neurology. And he's also trained in a treatment that's called Hemispheric Integration Therapy. And he's been having some notable success with it. In fact, he's here today to tell us about not only this work, but also his practice and some other things that he's working on. So, welcome, Dr. Manier. It's nice to have you join us today.
Thank you, Craig, for having me.
All right, I've heard from Google and I've heard all the way across the web about this Hemispheric Integration Therapy, and I've seen some pretty marvelous videos. Could you tell us briefly what it is and how it works?
Hemispheric Integration Therapy is really a function or a part of functional neurology. In functional neurology, you're looking at how nerves work or function as opposed to just the structure of the nervous system. So normally you would order an MRI, in this case of a child on the autism spectrum, and in essence it's all normal, meaning that all the parts are there, there's no stroke, there's no tumor or something of that nature. You see the wires are there, but they're not transmitting the information correctly. So in functional neurology, we are trying to find out what wires aren't working, and we're trying to find out what circuits and pathways aren't talking to each other. But we also want to look at the right and left sides. The right side of the brain is specialized to do certain things, and the left side is specialized to do certain things. And what we want to do is to make sure that there is a balance between those two sides so they can communicate more effectively with each other.
Now, I know there's a fancy word called neuroplasticity. What is that as it relates to our kids with autism?
Okay, plasticity refers to the old model where they thought that the brain was hardwired. So they use the computer model where there is you cannot change the brain, you cannot change the structure. But what we're seeing now is that the brain is not hardwired, but actually the brain is plastic or malleable, which means that by changing the input, you can change the function of the brain or make these pathways fire more efficiently. And as you make them more efficient, you can eventually change the structure also.
What are some of the success stories that you've seen? What have you been able to work with?
We have worked with, on the autism spectrum, we have had the entire spectrum, ADD, ADHD, Asperger's, Tourette's, and severe autism, OCD. They're all mixed and matched.
So what you've been able to do is to diminish some of the symptoms using this technique?
Again, if you look at plasticity or hemispheric integration as being an exercise for the brain. So if I stimulate a pathway in the brain and do it with a certain consistency and frequency, that pathway will become more efficient. So that's what we look to do with the functional neurology. We treat what we find, whether that be on a functional medicine or biomedical basis or in the functional neurology basis.
Is there a question of like overtaxing metabolic ability doing this?
Exactly. So when you are working somebody, if you're working out, if you're running, and you have a heart condition, people say to run 5 miles a day would be a great activity for you to do for your heart. But if you just had heart surgery the day before, if you do 5 miles, it'll kill you. So in this case, it's like baby bear. You can't do too much. You don't want to do too little. You do just the right amount, and that's how you get the most efficient results out of your stimulation.
Yeah, it's just like exercising. What does this have to do with epigenetics and genetics?
If you look at, again, if we use that computer model, the genetics has been likened to the hardware, and the epigenetics is the software. So the epigenome is the switches on the genes that tell them what and when to do it. So we can affect the epigenome, we cannot change your genes, but certainly it is the environmental effect on those genes that makes the changes. And we can affect how the genes express themselves.
I know that people are actually doing a movie about you and some of your services. Brian Derry is the fellow's name, and I think it's Triple Knot Productions, and that's coming out here shortly. Could you care to talk a little bit about what will be represented in this movie, what people will see of you and your services?
In the movie, what you're going to see is, and let me go back to one point I want to hit with the plasticity. Plasticity is cradle to grave. This particular woman in the movie, her child was 9 when he came to me, and she cried on his 6th birthday because she was told that at 6 years old, it's all over. Well, this child, when he came to me, was 9, and the point is that, again, that plasticity, or that ability to change the brain, happens all the way till the day you die.
Levi standing on a moving platform while wearing special colored glasses, touching a vibrating device, then sitting on a moving machine while touching his nose and then the doctor's hand. It's all a way of helping autistic kids exercise parts of their brains that cause them to have issues.
That's why they tell elderly people now that want to avoid Alzheimer's to do puzzles and things, or learn to speak a different language, because you can do this forever. So it is not, it's important for people to know, it is not over at 6.
So this,
go ahead.
Yeah, so this movie is actually documenting the study of a young man at the age of 9 and how you treated him with this hemispheric integration therapy?
Yes, so he'll go through, actually, he interviews her and has some old videos of him doing sensory, avoiding sensory issues. He had an issue where he would not quite stutter, but he would, just like he would say, the dog, I mean, he might say that 10, 12 times, to the point that he was frustrated because he couldn't communicate or express what he was trying to communicate.
Proof can even be seen in his ability to draw.
This is about the best of our artwork at age 8.5.
And months later, with all of his physical and mental training,
but we progressed in just 2.5 months to this. He's gripping a pencil now. He's writing his letters.
And the doctor's success with hemispheric integration therapy will be part of a documentary.
And of course, he had a little bit of Asperger's, like he had no friends at all. When she first came to me, she was pretty upset because he didn't have one friend. So you'll see that throughout the movie that he does actually feel emotion. In other words, he doesn't, many kids are taught to smile when something happens. They kind of lift their teeth up and they make a grimace. But he actually, if you see him now, he actually hugs his mom and he smiles, and it's feeling. So what we do in the functional neurology is we are increasing the brain's capacity to learn as we fix that area. So we will not teach him to use a spoon, teach him to play the piano, but we see a lot of parents who report that the piano teacher says he's doing better. He can read now. Levi, the child in the movie, could not read, and now he can read. So their reading levels go up, their math levels go up, their coordination goes up. It all seems to work together.
Okay, that's fantastic. Dr. Manier, how can people find more information out about you? What is your website?
You can go to Manier Center, MANECENTER.com. If you're looking specifically for autism information, we have a site called hitautism.com, HITAUTISM.com, and there is a site where I post, actually I get a lot of free information. Like this month there's Apple's giving away free applications for ABA cards in celebration of Autism Month, so we'll post that. We'll post gluten-free recipes, gluten-free websites, and information for people on it all the time.
Excellent. Dr. Manier, thank you for what you do for our special kids. It's always a delight to bring somebody on that is experiencing success in areas that people haven't gone before. And to hear of a young man at the age of 6 that was told there's no future, then at the age of 9 you helped bring him a future, that story gets repeated again and again and again. So you're a bastion of hope this morning, and I thank you very much for coming on and sharing your hope with the rest of Autism Hangout.
Well, thank you for helping me get the word out.
I hope we have a chance to talk about this again. So continued good fortune to you, and hopefully we'll see you again sometime soon.
Thank you.
And thank you, Autism Hangout. I'll be back again soon with another special report.